Hello, I'm Jennifer Hinke, the laboratory manager here at the Coachella Valley Mosquito and Vector Control District, and this is our invasive mosquito management program and arbovirus response plan. Aedes aegypti and Aedes albopictus can transmit dengue virus. Mosquitoes pick up the virus from an infected person, and after some time, they can transmit the virus to a new person when the mosquito bites. Zika, chikungunya, and yellow fever viruses have very similar cycles. At this time, we have not had any transmission of dengue or Zika in the Coachella Valley. But because Aedes aegypti mosquitoes are here, it is possible that we could have transmission in the future. The district conducts our work using an integrated vector management program. This means that the district uses a science-based approach to control mosquitoes and other viruses that are present. We conduct surveillance to determine when and where mosquitoes and viruses are present. We educate residents and property owners on how to reduce mosquitoes where they live, work, and play. When the conditions are right that control is needed, we use physical control by removing standing water where the mosquito larvae live, and we use chemical control, using the appropriate pesticides targeting mosquitoes where they live and are active. The district reviews the California guidance for surveillance of and response to invasive Aedes mosquitoes and dengue, chikungunya, and Zika in California, produced by the California Department of Public Health. Our invasive mosquito management program and arbovirus response plan adapts this information to be specific to the needs of the Coachella Valley. Our plan outlines how we carry out surveillance for mosquitoes and the viruses that they can transmit, what control options are available to us and what we use, how we communicate the risk of these viruses, and how we coordinate our work with other agencies involved. When someone is sick with dengue, their medical provider provides the information to the Riverside County Public Health Department. Riverside Public Health shares with us where the person lives as well as other information that will help us to reduce the risk of transmission to other people. Our work then is that the Surveillance Quality Control Department sets extra traps in the area to find out the abundance or the number of mosquitoes and sends those mosquitoes for testing. We check the efficacy of the control products that we will use to control adult mosquitoes, so our operations department can use the most effective ones. In operations, our vector control technicians use our internal system to see known mosquito habitats that need to be checked. They post mosquito activity signs at intersections and entrances to communities. They conduct inspections in the area, requesting to get into people's yards to look for mosquitoes, and they also look for areas of non-flowering plants where an application can be made to target adult mosquitoes that rest on those plants. Our public outreach department increases their communication to the community, targeting the same areas. They spend time reaching out to and educating leaders and residents in those neighborhoods. Once we have additional information on the abundance of mosquitoes from our traps and our inspections, we may be making additional responses. Typically, these are in the form of adult and larval mosquito control activities. Applications of adult mosquito control products are made in the evening or in the morning before sunrise, while applications for larval mosquitoes may be made at any time of day. We make these applications by truck and by helicopter, depending on how much virus activity and mosquito activity is in the area. We also reach out to our city, county, and community leaders directly to spread the word on how to help us reduce the mosquito population and how to prevent people from being bitten by mosquitoes. Public Outreach Department also shares this information by press releases, resulting in TV, radio, and newspaper stories. Once we complete this work, behind the scenes, the district general manager and department managers will also be having discussions with our county, state, and other mosquito control districts to coordinate efforts. We have ongoing discussions with our vendors to ensure that supplies can be replenished. We partner with the county to ensure that the medical community, that is our doctors, nurses, nurse practitioners, and others, recognize the symptoms of these viruses, so that patients can be tested quickly. There's work that all of us can do to protect ourselves and our friends and neighbors from dengue and other diseases that can be transmitted here. Some of that includes that we communicate with our elected officials on the importance of public health funding, not just for the district, but also for the Centers for Disease Control, for the California Department of Public Health, and for the Riverside County Department of Public Health. All of us work together to ensure that people are not getting sick. We can also, in our communities, routinely be proactive in protecting ourselves from mosquito and insect bites, and that includes wearing insect repellent anytime that we're outdoors. And finally, we can share this information that we know with our friends and neighbors to ensure that they are protecting themselves and making sure that we have funding for public health. Thank you for viewing this video. If you have questions or if you need service for mosquitoes or other vectors, please reach out to us by phone or by email. Thank you.